Hi, my name is Zachary Town, and as part of the Health Equity curriculum, today we will be discussing exercise and how to counsel patients on exercise. By the end of today's lesson, you should be able to describe the guidelines for exercise recommendation for people of all ages, identify the personal and public health burdens of physical inactivity, describe the benefits of physical activity, list resources we can use to help people stay active within any age group, and then demonstrate those counting skills for people who want to exercise more. So before we get into the guidelines for physical activity, I thought it was appropriate to go through what's actually considered physical activity. So effectively, we can break it down into three different groups, that being light intensity activities, moderate intensity activities, and vigorous intensity activities. Now, your light intensity activities are activities where minimal effort is expended, meaning you're really not trying to be all that active. So the idea here is that you're walking around a store shopping, or you're just washing dishes, or you're working at a desk. Not something that we would necessarily call active. The next step is a notable step. It's the moderate intensity activities, and this is where you're expending 3 to 6 times the effort compared to light intensity activities. So this can include brisk walking or dancing, hiking, doubles tennis. Doubles tennis is a popular one to bring up in the literature for whatever reason. And obviously, there's going to be some wiggle room between moderate intensity activity that we just discussed and vigorous intensity activities. Vigorous intensity activities are described as 7 to 10 times the effort expended, so far more than light intensity. And these can include things like running or hiking up a steep grade, up elevation, swimming, team sports like soccer and football, and aerobics. But of course, things like dancing can easily fall into this category too, depending on how intense it is. Obviously, same with tennis. So if you want to be very qualitative about these exercises, or perhaps you have patients who love numbers and data and comparing things more quantitatively, like I said, then you can discuss physical activity in terms of a unit called the metabolic equivalent of task, so, or METs. One MET is defined as sitting at rest, so the energy expended sitting at rest, just, existing. And it's also defined as 3.5 milliliters of oxygen per kilogram body weight per minute. So you can define it as oxygen consumption relative to the person. And when you do that, you start to see that those numbers from the previous slide effectively represent a spectrum. So your light intensity activities are effectively from one metabolic equivalent of task up to 3. Moderate is 3 to 6, and then vigorous is 6 onwards. So this is the real, I guess, meat and potatoes of this whole video. The guidelines based on 2018 physical activity for Americans. So if you notice, it's broken down into 3 different age groups: 6 to 17, 8 to 6, or 18 to 64, and then 65 plus. Now, those are probably going to be the 3 age groups we discuss as young people, adults, and older adults. Going down the aerobic activity recommendations, we can see that for young people, it's recommended to get 60 minutes of moderate or vigorous physical activity, including at least 3 days of vigorous physical activity per week. Now, in this case, if you notice it says 60 of either, generally the rule of thumb is that 1 minute vigorous physical activity is equivalent to 2 minutes of moderate, and that's kind of based off those numbers in the past 2 slides. Going forward, and this is where you see it again, for adults, it's recommended to get 150 to 300 minutes of moderate exercise a week. or 75 minutes of vigorous physical activity a week, or some combination of them. But that's where it highlights that 2-to-1 ratio. And then for uh, older adults, it's the same recommendations for adults. You just want to be aware of their abilities and health conditions. So obviously, as we get older, we lose some, but you don't have to lose all physical conditioning. And it's just the note there is just to push them to what they can handle. Now, in addition to aerobic, there's also muscle strengthening recommendations. So for young people, um, the muscle strengthening recommendations are just part of the aerobic activity recommendations. There should be some bone loading activity, meaning um, where your bones are bearing weight more than usual in order to make sure they're properly strengthened. For adults, it's recommended to get 2 or more days a week of muscle strengthening, in that it's targeting the entire body. And then uh, probably the more important thing to point out is that for older adults, it's the same recommendation, but now there's an emphasis on balance training and a combination of strength and aerobic activities. And this is to help with, again, bone strength and preventing falls, which is typically a concern for uh, older adults. And then overall, at all ages, it should be emphasized that people should sit less and move around more, meaning that they just take the time out of their day. Instead of sitting at their desk, they stand or they walk. Or a popular one is to try to hold meetings while walking rather than sitting down. Um, that's just general advice that we can give to all of our patients. So, what are the risks or the outcome of being physically inactive? Well, based off the data we have, a little more than 25% of US adults don't engage in any physical activity. So that's 1 in 4. Um, and then half the people don't get the recommended amount of aerobic exercise. And due to that lack of physical activity, we see increases in coronary heart disease. So it's at 33% increase. It's a 33% increase for breast cancer as well. And then we see 20% increases for type 2 diabetes, colon cancer. The combination of coronary heart disease and type 2 diabetes can also be called metabolic disease. And then overall, roughly 10% of premature mortality is associated with not getting enough physical activity. And then as far as healthcare goes, it's reported that $117 billion a year are accumulated in costs of physical inactivity. For the risks, but let's just go through some of the benefits, and we can discuss the benefits by age group. So with young people, consistent exercise reduces the risk of depression. Obviously, we'll see increases in aerobic, muscular, and bone health. But as probably a more salient point is that it can help improve attention and processing speeds, which we can use as measures for academic performance. So the idea of like the jock um, performing poorly academically is not necessarily the case. You want to have children be active because it's shown to help improve their grades and how they perform. With adults, more broadly, we see it lowers the risk and just generally lowers blood pressure, lowers the risk of stroke because of that. And then we see improvements in mental health, so moods, improves cognitive functioning. It can reduce arthritic symptoms, and also it can help prevent weight gain. And we'll go over weight gain and weight loss more specifically in a few other slides. Older adults, it can improve their sleeping habits, which is a common complaint as you age. It reduces the risk of fall, like we were saying, by improving balance and joint mobility. And because of that, it can extend the years of active life, meaning the years where they are at the same level of activity or comparable level of activity as they were throughout adulthood. It can help prevent weak bones and muscle loss, and then it can delay the onset of cognitive decline. Before that, roughly 10% of premature mortality is associated with physical inactivity. And I thought that this graph uh, pairs well with that idea. So this is a graph relating physical activity, hours per week, at leisure time, meaning outside of activities associated with work, um, to the hazard ratio of mortality. And so if we start all the way over to the left, you notice that at 0, there's a ratio 1-to-1, meaning that's what we're defining as the ratio without any physical activity. And then as you move to met hours per week, so they helped us and defined that if you reach 150 to 300, you're in those middle bounds. The drop, the risk drop goes to about 70%. So you have 70% the risk of all-cause mortality by meeting these thresholds, which is significant, and the decline occurs rather quickly. And then as you continue, it does continue to decline, but at a much slower rate. And in addition to the sit less, move more idea, here's another graph showing the relationship of moderate to vigorous physical activity and sitting time, and connecting that to the risk of all-cause mortality. So again, as you move over towards more and more physical activity and less sitting time per day, the risk of all-cause mortality quickly drops. Yet, if you look in the top left, no physical activity and sitting all the time has that peak, that vibrant red risk. So this is just a quick little summary slide to maybe bring up with your patients as you're weighing the risks and the benefit. I'm sure that patients may be aware of some of these benefits, but it's just worth bringing up to them, saying like, okay, let's weigh out, like, you might have to take some time out of your day, a little bit here and there in order to exercise, but you get all these benefits and you're preventing all these risks. So there's this common idea that enough exercise will help you lose weight and lose weight quickly. And it's physical activity certainly does help with your body weight. That is a benefit, but based off the evidence that we have, the best way to lose weight and to keep it off is to primarily adjust your diet and nutrition first, meaning that diet and nutrition is the larger part to weight management, and that physical activity can certainly help and certainly augment, but it is not the major focus. So meeting the guideline of 150 minutes of moderate exercise can help keep weight stable. It can help fine tune weight, but it's not going to help you drop, the extra 10 or 20 pounds quickly. Increasing up to 300 minutes can help lose weight, but again, it's not going to be drastic. And the thing to bear in mind and to bring up with your patients is that when you exercise, you are burning energy, but your body's going to be hungry afterwards. You're going to feel hungry afterwards, and so it's difficult to do all that physical activity and then not eat afterwards. So it's important to bear in mind. So as we get into the counseling aspect, I wanted to quickly highlight a collaboration between the American Medical Association and the American College of Sports Medicine. This collaboration is called Exercise is Medicine, and it just reflects this philosophy that exercise and exercise counseling should be a larger part of the conversation in primary care with our patients, and really focusing on making sure they're getting enough exercise, that they know how to exercise, and the resources available to them to make sure that they can accomplish it. And it goes so far as saying, here's your exercise prescription. Here's how you can network within the community to find a personal trainer or a workout group. So as we go through these counseling steps, a lot of these resources are pulled from Exercise is Medicine. So before we get into actually counseling patients, I thought it would be helpful to review the stages of change or the trans theoretical model. Um, 5 different stages of a person's behavior as they're making that behavioral change. And it can be helpful to identify at what stage the patient is at to help them better succeed in going through that change. So the first is just pre-contemplation. So this is when they're unaware that the behavior is in need of change or they're not planning on making any changes. Um, so just relative ignorance or avoidance. Then we can see contemplation. So this is where they've begun to think about it. There's no uh, decision yet. They're seeking support from others and looking for more information as to how to approach it. Finally, once there's that decision, they typically go into the preparation stage. So they're planning on making that change. They're gathering the resources and things that they'll need. They're still gathering that support and confidence to make sure they'll be successful. Typically, they'll have a quit date in mind or some target to begin whatever whatever behavioral change. So in this case, physical activity. And then the last two, action and maintenance. Action is a larger or a longer period of time. It's taking those steps and enacting that plan from preparation. Can take a few months. And then finally, maintenance is what happens afterwards. It's checking in to make sure that they're still adherent, helping them if they've had a lapse or two. But typically, it's just engaging with that behavior, achieving the results that they want, and just making it part of their life. Now, the standard exercise counseling technique is the 5 A's. It's familiar with alcohol and smoking. In this case, we're starting at the bottom. We're going to ask and then advise, assess, assist, and arrange. So we'll go through these kind of step by step. So as part of ask, from Exercises Medicine, they have this handy acronym PAVS, or physical activity as a vital sign. And this is just simply 2 questions we can ask at the beginning of the visit along with their vital signs. Perhaps other office staff can help with this, that we can just ask in order to get a gauge on how physically active they are. So the 2 questions are, on average, how many days per week do you engage in moderate to vigorous exercise? And then they provide the option of like brisk walking as moderate exercise. And then on average, how many minutes do you engage in physical activity at this level? So you get days per week and you get minutes per week, right? And so this can help identify how closely they're achieving the guidelines. In addition, you can tack on the question, how many days a week do you perform muscle strengthening exercises, such as body weight exercise or resistance training? And that can help you check off the muscle strengthening guidelines as well. So during the advise portion, this is where you want to bring up the statistics we mentioned before, like the 33% increase in breast cancer if you're physically inactive, or the 33% increase in coronary heart disease if you're inactive. In addition, another key piece of information to provide is that this exercise builds up in increments of roughly 10 minutes. You can even go lower than that, but 10-minute per session is enough throughout the day to build up. And this can just help patients feel as though they don't have to do it all at once and feel discouraged by that. In addition, you can also address motivations. So you can say it's going to improve your health. You can help them understand that it might improve their social life by bringing them around more people, can help with their personal appearance if that's something that they're concerned about. And then for our patients who also smoke or are trying to quit, it's been shown to assist with smoking cessation. So kind of a double whammy. So hopefully the discussion of physical activity between you and your patient has led to the assist portion of the 5 A's, where you're helping them create a plan, And so from Exercise is Medicine, they have a document that is effectively an exercise plan that can help the patient um, narrow down their goals and figure out what type of activity they're interested in and what they've done in the past to have everything all in one place. So you can even use this to refer your patient to a personal trainer or a group class instructor or a gym, really just about anything. And you can pick out the activity location, like it says, what they've done in the past, what their current goals are, where they currently are as far as assessment and fitness and function, and go from there. Now, while you're helping your patients create a plan, obviously not everyone is going to start at the same spot. And so we can view physical activity as this spectrum where we can modify as we go. So the first idea is just to target activities of daily living, maybe prompting them to walk more, take the stairs, park further away from their destination so they do have to walk more. And if that's something they're already doing, then you can prompt them to consider something like more active modes of transportation. So if they have to run errands, perhaps they can walk or bike, or if they have the ability to, they can bike to work. Even going further than there, we can add on additional activities like walking the dog more if they have a dog, raking the leaves if they live somewhere that has fall and falling leaves. Same with shoveling snow. So these are ways to stay even more active, and then we can push them along to physical exercise. So more structured aerobic activity and strength training, or maybe a combination of the two. So again, as you're assisting patients, you may hear concerns from them, perhaps as reasons not to do a particular activity. And I thought it was beneficial to point out, as far as injuries go, um, there's only about one injury per 1,000 hours spent walking. And even though running has the stigma of being worse, there's only about 4 injuries per 1,000 hours spent running. So if they are concerned, so long as they're doing it correctly and they're not pushing too hard, it's not a concern. And then as they are going through a plan, you may find that they're either too gung ho and they're starting off too quickly, um, or they're looking to achieve a goal too quickly and really push themselves too hard because you do want to prevent injury. So what I've put on the bottom of the screen is the general philosophy for exercises. First, you can increase the duration that you're active, and then you can add in more frequency, so maybe more days per week. And then as you do that, you can increase the intensity of the workout, but you don't want to start by massively increasing how much weight you lift, for example. And this also goes with the physical activity plan of FIT, so it's frequency, intensity, type, and time. This is how you can help them plan those physical activities. So with all this, it's good to be mindful of chronic conditions. When you're talking to patients, you want to be on the lookout for cardiovascular diseases, renal diseases, and metabolic diseases, simply because if it's not well controlled, if they have many symptoms, then it might be harmful for them to begin exercising without medical clearance. So on the right here is a flow chart that just kind of walks through when it's appropriate. Um, I'm not necessarily going to go through step by step, but it might be wise to pause and just go through it on your own. Since we are talking about chronic conditions and whether or not a patient should exercise, I thought it was important to point out from Exercise is Medicine, they have a whole host of exercise prescriptions for medical conditions. You can see them on the right here. Basically, you can go through any of these listed and click on the link, and they'll have what are considered the current recommendations and some tips and tricks for your patients. So I highly recommend checking that out. So as part of the range, you can always refer them to see different specialists. In this case, you might refer them to an exercise physiologist if they do have some of those chronic conditions and need to be cleared first, or just in generally, if they have a past injury that they're concerned about, an exercise physiologist can help. Personal trainers can be used for patients who have means, um, but maybe not the motivation to do so. And then for those who are looking for the social aspect, you can always point them towards group exercise instructors who typically might be found in a gym. These are kind of the network that are going to be local to your area that you can help use to get your patients active. It doesn't necessarily help to say you can tell your patients to be more active without having some resources for them. So for young people, you can always have them check local YMCAs, YWCAs for programming. They might find swimming lessons or recreational sports. You can also use the Boys and Girls Club of America for that as well. And then I've linked Healthy Children. It's a pediatric uh, website that goes through just different physical activities and just exercises that children can do. For adults, a little more broadly, you can use Walk with a Doc. So this is where doctors will organize walks, and you can just honestly walk with a doctor and get that exercise, and also just discuss general health as well. The American Heart Association has a community search, so you can plug in your information there and then be able to find classes or programs near you. And then another one that I thought was interesting is Park RX. So this is an effort to uh, have people engage with the local parks, states, and national parks around them and engage in hiking or walking in order to uh, meet those exercise guidelines. So I linked a few different more nationwide programs for older adults. Silver Sneakers is pretty commonly known. They'll help senior citizens find uh, gyms and local programs, typically might help with the cost. And then the programs that are chosen are specifically will help older adults with physical activity. National Council on Aging also helps find some of these programs and provide some at-home resources. And then this nationwide physical activities program, this link from the CDC, specifically helps with arthritis, but then shows even more nationwide programs. So some take-home messages for patients that we can just kind of hammer home and really make sure they understand when they leave is that exercise has benefits at all ages, whether it's improvement in school or just reducing the risk of strokes or high blood pressure or delaying the onset of aging. Everyone should be doing it. They don't need to start off at 100% going for the heaviest weight or the farthest run. Not everyone is running marathons, but that they can build up over time. And that's the idea of going for increased durations and frequency and then intensity. Meet them where they're at rather than where their goal is. And then help them rely on their daily structure to achieve their goals. Um, Help them see where they might have 20, 30-minute chunks where they can get some exercise in rather quickly, or what activities they do throughout the day that they can make more active in order to meet those guidelines. And then finally, just help them be consistent, help them uh, stick to a structure or a plan so that they can build this habit and have it stick. So that's all. Thank you.